International. My name is Natasha. Today I will discuss about OSCE samples which PEBC have introduced on their official website. So without wasting any time, let's get started. So as you can see that I have written over here PEBC OSCE samples. I'm gonna click on the first link. When you're gonna click on the link, you can see the format of examination stations. I have made complete video for the same. I will share the link in the description box for the same. You can watch that video as well. Now comes to the references in the station for the PEBC OSCE. You can see there are some references, for example RxTx, Rx files, clinical drug data. Sometimes topic is related to natural medicine, so obviously the reference related to the same. Sometimes the topic could be related to pregnancy and lactation, so this is one of the references, drugs in pregnancy and lactation by Briggs. Health Canada publications, sometimes obviously other professional references whenever it's needed. Now comes to this OSCE sample stations. There are 5 stations you can see here. Like station 1 is interactive, station 2 is also interactive. Now station 3 is non-interactive, 4th is non-interactive, and 5th is again interactive station. You can download the station, you can watch the videos as well. So let's go to the sample station 1. So sample station 1 is related to cancer pain control. I'm gonna download it. So basically whenever any station is there for the OSCE, it will let you know that what type of the topic is there. Usually you will see, let me show you, these type of papers gonna be there. You can see the patient record, you can see patient name, age and everything. You can see the patient medication history. So these type of pages are already there. This is kind of a patient record. Always double check the patient name, or I would say identity. You should ask about the allergies as well. Whenever you're gonna talk to the patient, you need to identify with the patient name, date of birth. At least 2 identification markers should be there in order to find out whether you're talking to the patient, is it the right patient or not. Because sometimes the prescription is for the patient, but the person who is coming to pick up or to drop off, maybe it could be a caregiver or somebody else as well. Every patient case scenario, every scenario for the OSCE have some of the competencies need to be checked. For example, in this particular station, they are checking the competency related to patient care and competency related to communication and education. So in this case, patient care is must. So in case if you have done everything correctly, but you put the patient on risk, maybe your answer or your station gonna be marked as unsold or properly not sold at all. So putting the patient at risk may lead to failure of that particular station. So always make sure don't put patient at risk. So I can brief you whatever written in this particular station. So always, as I told you, always ask for the allergy. Another thing you need to ask about the over-the-counter medication. So this case is related to cancer pain. The patient is taking morphine pills exactly at 8 a.m. and 8 p.m. Despite having MS content, which is a long-acting morphine, he experiencing the pain between the doses of morphine, for example, around 5:30 to 6 p.m. So the patient went to the doctor and doctor has given the liquid morphine for the breakthrough pain. So as a pharmacist, we need to discuss to the patient related to both morphine content as well as morphine liquid. What is the use of morphine liquid now, and he should be continuing using the morphine MS content which he is taking 8 a.m. in the morning, 8 p.m. at the night as well. When you see over here the patient, let me just show you, sorry. So if you can see here, the morphine oral solution, which is 1 mg per ml, and doctor has written 5 ml every 4 to 6 hours if needed for pain. So you need to clearly mention to the patient every 4 to 6 hours if needed. In case if he doesn't need to take it. If you're gonna say to the patient, okay, take this medication every 4 hours, or you're gonna say take this prescription every 4 to 6 hours, it means he gonna take it whether he need it or not. So it's gonna be partially unsold. So make sure you're gonna explain the patient as it is written on the prescription. Apart from that, you need to explain to the patient that the patient need to continue the morphine MS content as he is taking before. For example, he was taking, as you can see in the patient standardization letter, you can see patient was taking Tylenol. If you haven't asked patient any over-the-counter prescription has been taken by you or not, so maybe he won't tell you that yes, I am taking over-the-counter Tylenol. So always ask any over-the-counter any medication. In case he will not explain you about his constipation. For example, obviously morphine is one of the medications which have constipation as a side effect. In case he will not tell you, it's our duty to ask about the common side effects and how he or she is managing the side effects. For example, drowsiness is also another side effect. So you need to explain about the drowsiness again, and you need to give the proper management of that side effect as well. Whenever there is a station, there is a specific checklist on the basis of that station. For example, in this station, this is a complete checklist, what the examiner gonna look. Obviously, as I told you, confirm patient identity, confirm that patient is taking the long-acting morphine every 12 hours, like 8 a.m. in the morning, 8 p.m. in the evening. Determine that yes, patient is experiencing pain between the doses. So that's another thing that examiner wants from a pharmacist to find out, that what is the reason of the the morphine liquid given to the patient. Okay. Explain the use of both medication as I told you before. Obviously, explain dosing. 5 ml every 4 to 6 hours if needed. You can also suggest the patient to make a logbook so that they can write that how many times they are taking in a day the extra dose for the breakthrough pain. You can also explain, as I told you, drowsiness or the constipation. And again, as I told you, you should explain the management of the constipation. For example, you can say some more fibers in the diet, increase your fluid intake. And obviously, as I told you, you should ask about the over-the-counter. So whenever you're going to ask the patient, maybe patient going to say, yes, I was taking Tylenol, but it was not effective. Okay. And you can obviously, because now the patient gonna take the MS Contin as well as MS morphine liquid, so there is no need to take Tylenol. You can explain them, yes, either take the appropriate dose or you can suggest stopping the Tylenol. As you can see over here, if you're gonna explain incorrect dosing of the liquid morphine, for example, as I told you, taking regularly, take Tylenol first, then liquid morphine. If Tylenol doesn't work, you can take the morphine. This is kind of unsold case. So if you're able to see here, you can see the rating. Communication, there is a 1 rating for the communication. There is 1 rating for the outcome. There is 1 rating for the performance as well. In case you are giving the misinformation, there is 1 proper column for the same. Again, there is a specific column for risk for the patient. If you are putting the patient on risk, maybe the whole case gonna be unsold, or you can fail that case. So make sure do not put patient at risk. So that was the case. Obviously, there are another sample stations. You can listen to the video, you can see that particular station, you can download the station, you can see the patient and other person's interaction. Now there are obviously sample station 3, which is non-interactive, 4th is again non-interactive. So this is official website for the OSCE. So I would highly recommend always watch at least these 5 cases you should see, and you're gonna see what is the checklist for every single case scenario. So that is all about this video. I have made 2 or 3 videos related to OSCE. Please watch those videos so that you will come to know, for example, what you can expect on the day of OSCE examination at the examination station as well. If you have any questions or concern, you can comment in the comment section box, or you can always follow me on Pharmacy International Instagram page. You can also DM me over there as well. Thank you so much. Have a wonderful day.